This video is about Stim for a denervated muscle, and for this case we're just going to pretend that we're doing the quadriceps, for example. The goal of the treatment is to stimulate and produce a muscle contraction in the denervated muscle, and that will be going directly to the muscle fibers, and it won't be going through the nerve since that nerve is denervated. It is indicated because we want to stimulate that muscle and decrease the amount of atrophy that could occur and just slow that down. Contraindications that we would want to check prior to doing this: we want to make sure that the patient doesn't have any pacemakers, defibrillators, unstable arrhythmias. I want to make sure I don't do it over the carotid sinus, or if they have any arterial or venous issues. I wouldn't want to do it over the lower trunk area if they're pregnant. I would want to make sure and watch for cardiac disease and watch for malignancy as well. I would also want to assess the skin and the mentation to make sure that we get some good feedback from the patient. And then I want to do that prior to administering the modality. And then the parameters of this, I'm going to choose to do a pulsed alternating current to the point of a muscle contraction. So that's the amplitude. And then I would want to do it for greater than 10 milliseconds because it needs that longer time period for the pulse duration. And then I would want to do an on and off time of about 1 to 5. And I would probably do it at least 35, at a frequency of at least 35. So the application of the modality, I would want to make sure that I have an electrode at the motor point, and I also want to make sure that there's one going with the fiber, and they would be a decent size electrode since it is the quadriceps, being a big muscle. I may have like a bolster underneath the knee or underneath the leg in order to put the joint in like a mid-range and get like an optimal position for the patient. I would want to make sure that the patient is comfortable, and I want to make sure to follow up with skin checks at the end. I'm not really sure what other interventions could be good for this treatment goal.